another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Annie Martens to speak on healing diastasis rectus abdominis. Annie Martens is the owner of Bella Bellies, and Annie took her experience as a personal trainer, Pilates instructor, childbirth educator, doula, training and midwifery assistance, and a mother of 3 to develop movement programs focused on women. Currently, Annie is providing teacher training through Bella Bellies to maternal professionals and fitness professionals. She also presents seminars and workshops to maternal professionals throughout the country. Annie's passion for maternal well-being and techniques has inspired her to write the Bella Bellies book series. The Bella Bellies books address fitness during pregnancy, postpartum, menopause, and beyond. The book thoroughly discusses and reviews step-by-step instruction for the following: movement during pregnancy and birth, preventing or resolving diastasis rectus abdominis, techniques to help prevent pelvic floor dysfunction, core movement, post-cesarean section, techniques to help prevent osteopenia and osteoporosis. For more information, please visit her website at bellabellies.com. Welcome, Annie.
Welcome. Thank you for having me.
Yes, I'm so excited to have you come and speak to about the type of work that you do, because I think it's so important for women to have an awareness about what is going on with their bodies during pregnancy and during birth.
Absolutely. So very important.
Yeah, it's huge. So, I would love for you to share with our audience today a little bit about your personal experience that inspired you to become an expert in this subject.
Sure. I was pregnant with my daughter, Raina, in 2005, and she was born in 2006 later on. So throughout that year, I had been studying Pilates, participating in Pilates, and unbeknownst to me, not modifying the technique properly. And somewhere during the course of my pregnancy, my obstetrician pointed out that I had a rather large separation. And by separation, I mean the 2 halves of the rectus abdominis, which begin or originate in the pubic bone and the hip bones and move up to the rib cage around the breast. And they're 2 separate halves of muscles, superficial muscles, had almost unzipped, if you will, and separated away from the midline of the body. And my obstetrician recommended modifying exercise and being very certain not to do any exercises that would create intra-abdominal pressure, such as backlying exercise with forward flexion. So that would be a crunch-like position, and or backlying exercise where you lift the legs up to 90 degrees, straight up towards the ceiling, lower them down towards the floor, and lift them back up. And he recommended not doing that at all, even if I had a wedge or a pillow underneath my back, because of this concern of diastasis. And I was a little bit taken aback because the program I had been participating in, to one degree or another, had been modified for my pregnancy. And I thought, gosh, if this happened to me, it could happen to anyone. This is back in 2005, 2006. Things have since changed, and now the fitness field, is gradually accepting what we call diastasis rectus abdominis, the separation of the rectus abdominis during pregnancy, as something that does in fact happen and does require movement modification during pregnancy as well as postpartum. And I do hope that trend in accepting diastasis rectus abdominis, which I'll now refer to as DRA, continues to grow, such that more women are aware of this condition and aware of the side effects of this condition.
Yeah, it's so important. So once you want to share also then, once you gave birth, what you did to heal yourself.
Sure. At that time, it took a lot of independent study because I had reached out to a variety of professionals, including physical therapists, and the PTs even, physical therapists, really weren't familiar with diastasis rectus abdominis. And they thought it was a sign, this one individual thought it was a sign of core weakness and recommended doing crunches. And I knew from what I had studied that is not at all what you want to do. In fact, crunches could make it worse. So somewhere along the line, I came across Julie Tupler of Diastasis Rehab, which was formerly Maternal Fitness, and I began to study with her. And I studied with her, and I began modifying a variety of techniques, including Pilates and personal training and other approaches to movement or modalities of movement with her guidance. And she inspired me to start Bella Bellies, which was formerly in Hoboken. And since moving from Hoboken to Erie, Pennsylvania, it's now in Erie. But that's been the journey to get me to this point, and it's been a lot of studying. Fortunately, now there is a division of physical therapy, and it is more out there, if you will, more available to women. That is women's physical therapy. So with that said, it specializes in pelvic floor conditions or dysfunction, as well as core dysfunction that's unique to a woman. So if a woman has a really severe diastasis rectus abdominis or DRA, which is a severe DRA, then that might be a professional that one can allocate out to. But the key is prevention. Prevention during pregnancy and prevention certainly after, and possibly even before pregnancy. At any point, if an individual is carrying their weight around ineffectively and creating intra-abdominal pressure that bulges out and forward against the rectus, they could eventually develop a separation at any stage in life. It's just during pregnancy, from the shift in hormones, the heightened increase of intra-abdominal pressure because you're having a baby in there, possibly twins, more than one baby maybe, fluids, so on and so forth. That just creates the right environment for the separation to happen in. And also postpartum, not a lot of people know about that, but postpartum, you really, even if you don't have a DRA, you need to continue modifying your movement so you don't develop one. Because it takes about a year in postpartum or 6 months after a woman has stopped nursing for her body to possibly realign itself, for the hormones to resync. And if we start jumping too far into heavy, I'm going to refer to it as fitness training, and that can span a broad modality of movement techniques, whatever it may be, if it's too intense and it's not properly modified, then certain conditions postpartum can develop, one of those conditions being DRA.
Wow. So that's so important for women to know. You know, I see a lot in my office, women after having a baby are so eager to get their pre-pregnancy bodies back. And as soon as they're cleared by their doctor for physical activity, they're at the bar classes and they're running and they're really doing some pretty intense type exercise. So what would you recommend to a woman, especially a woman, let's say, who is already fairly fit and, you know, has an exercise background? What's the best thing that she can do to help prevent this from happening during the pregnancy as well as after?
Sure. During pregnancy, the best thing she can do is be aware of how she's moving in general, and also postpartum as well. Be aware of how she's moving. Is her posture good, such that the shoulders are over her hips and her spine is on and strong? I know as a chiropractor you probably speak to that or do speak to that, I know as a fact, quite a bit, the health of her spine and the relationship of her core to her spine. Or is she maybe rounding her shoulders, pressing her hips forward, and allowing the weight of her abdomen to kind of drop out and forward away from her spine? That can, with time, slowly create a DRA. Now you combine that poor posture with something such as lifting, where you're doing some, what you call like frontal loading. You're lifting up groceries, or you're lifting up a bag of whatever. Maybe for our moms who have children and they're pregnant with their second, third, so on and so forth child, maybe they're lifting their other child. Well, that too can, with poor posture, can contribute to this DRA. So we really want to look at biomechanics and to make sure that you have a healthy, strong, stable spine that's supported by healthy musculature. So watching the carriage. Other than that, the next thing, or the next tenet I like to introduce, the principle I like to introduce to my mom, whether it be pregnancy or postpartum, is avoiding certain activities. And those activities would be crunches or any movement where a woman is laying on her back and she rounds her shoulders forward. So she brings her head towards her pubic bone, very crunch-like position. So forward flexion where she's lying down. What happens with that is the weight of the head, the weight of the shoulders, the weight of the whole thoracic upper carriage, that pressure goes downward in towards her belly, and pressure follows the path of least resistance. That weight and that creation of tension goes out through her rectus at that point and causes a further separation. So you want to avoid crunches, or you want to avoid any position where one is laying on their back and they're rounding the spine, where they lift their head, shoulders, and heart off the floor. And that's not good. Another thing or movement you want to avoid is where, again, you're laying on the floor and you lift both legs up to the ceiling such that the legs and their relationship to the ground is 90 degrees. And then from there, one would lower their legs down to either 45 degrees or straight down all the way to the floor, and then lift them back up. It's actually somewhere between the lowering and the lifting that it irritates the rectus and it pulls it apart further. Oftentimes that's referred to as jackknifing in the fitness industry, Pilates, yoga, personal training, group exercise. You might see that present. So you want to avoid that. You also want to avoid, and I could go on about this and on, so feel free to stop me at any point. There's a lot of avoiding and a lot of preventing we want to do, because that's huge. You want to avoid during pregnancy plank position. Now you can do plank against the wall as long as you can control your core. So as long as you feel or one is aware that they can pull their belly or their baby in back towards the front of their spine and up closer towards their heart. So maybe plank against the wall would be okay if they can control that. But certainly standard plank where the body is parallel to the floor with the arms and the toes supporting the body, you need to avoid that as well, especially second and third trimester. What happens is the weight of baby or babies, depending on our moms, that falls towards gravity. It falls downward, and it goes through the pressure, goes against and possibly through the belly button or the umbilicus, where we all have a natural separation or diastasis, just a natural separation so that our umbilicus can be there, our belly button. Anyways, during pregnancy, the weight of that goes down there, and you start to see a greater separation. It starts to pull apart even further. And by separation, I mean a separation of greater than 2 fingers. So the 2 halves of the rectus muscles have opened greater than 2 fingers. And by 2 fingers, that would be 2 fingers to the individual, so that the finger width apart is proportional to their body. So you want to avoid plank. You want to avoid down dog. That certainly applies to down dog. In fact, I think down dog is a little bit worse than plank. I've seen my moms come in and they say, a lot during my pregnancy, I did down dog. It was a great stretch. But I didn't do any crunches, and I didn't do any jackknifing. I didn't do any plank. But here they have this huge separation, and I feel that there's, anecdotally speaking, there's a correlation there across all the moms I've worked with. And just to give you a reference point for that, I've had the good fortune through group exercise, through personal training, through the doula work that I do, childbirth ed, I've had the honor. It's just been a wonderful experience to work with over 4,000 women. So I started to see a trend in that pattern. Mm-hmm. The other thing you want to avoid is unmodified all-fours position, very similar to plank, where you have gravity pulling down on the belly button, and you have that baby in there and all of that fluid weight that surrounds baby. So one needs to modify an all-fours position, and that's actually very simple to do. You can just take an exercise ball and put that underneath your chest and allow the weight of your upper carriage to rest on that exercise ball or burning ball. It's actually a great position to labor in as well, especially if you're having back labor. It opens the pelvis 30%, gets the weight off your lower back, just throwing it out there. But coming back to DRA, that will also help support the weight of the upper carriage so that all of it isn't falling downward towards the umbilicus. So good biomechanics and prevention through exercise modification is huge.
Wow, that's so interesting that you were talking about the downward dog position. I've never heard anyone say that before, but it's similar to a plank, and certainly we can see, gravity just pulling on the belly in that position, and that would put stress on the abdominal muscles, so it makes perfect sense.
And it's also the thighs push against the lower aspect of the belly, so they, depending on the pregnancy, they push the weight of the belly up and down. So they're pushing it up and down towards the umbilicus. So I've found, and anecdotally speaking, that women who did a lot of down dog during their pregnancy come to me with a worse DRA than if they had done even like plank, which isn't, it's not great, than plank or all-fours or, so on and so forth. So I found that really interesting. It's something I'm noticing, but just to be fair, just to put it out there.
Yeah, I think this is such good awareness. I'm a huge advocate for prenatal yoga, and I think it's wonderful. And I've never been to a prenatal yoga class, but I'm assuming they don't do downward dog. But now I'm curious.
Yeah, that's correct.
Yeah, they don't do what you said?
If they're modifying correctly, and I've had the opportunity to work with yoga instructors through my teacher training, and we teach them, or I teach them, how to modify that down dog so that that pressure of the thighs isn't against the lower belly. And then also we don't have the head below the heart, so different, low blood pressure when they bring their head back above their heart doesn't hit them. There's a variety of reasons beyond concern for DRA that maybe down dog isn't the best exercise for pregnancy. And that's the thing about our instructors. That's why I love to work with teacher trainers, because it's our job as fitness professionals, whatever modality it is, to modify and to modify properly. and to sometimes get creative, because that's what our clients are paying us to do, to figure out the most safe, effective exercises. So just to continue on that line, if pregnant women out there and postpartum, I actually think postpartum women are a little bit more vulnerable because they get the clearance from their healthcare provider, and they can sometimes be misled and think they can go out there and just do anything once they have that clearance. There still needs to be modification. But when selecting a program, ensure that your instructor has at least 100 hours of studying. I'm very proud of my teacher trainers, all of them. And they've taught me so much. And I get to work with them for about 200 hours before they get their rings, if you will, and then they can go out and work with this subpopulation group. Unfortunately, there are programs out there that are weekend programs, and maybe they're working with the teacher trainer for 4 hours, and then they're quote-unquote certified. And I think that needs to change in the fitness industry. So, Bella Bellies, it's about a 200-hour study program, and there's different levels of that. We have women and men who participate up to, they get to their 50-hour point, they get to their 100-hour point, and then they get to their 200-hour point. So if anyone would like an instructor who's been certified, they're welcome to contact me.
And they should shoot you an email? Is that the best way to contact you?
Sure, at info, short for information, the sign at, and then Bella Bellies, which is B as in boy, E as in echo, LLA, B as in boy, E as in echo, LLIES, info at bellabellies.com.
That's awesome. And I mean, you've trained so many people. I know when you were teaching here in Hoboken, I had the honor of coming over and speaking to your students, and they really got such a thorough training in how to take care of women during pregnancy and postpartum, which I think is so important, like to have that awareness that a woman's body is in a very different place than pre-pregnancy and for, like you said, a year after giving birth.
Oh, sure. And it was such a great honor, if you will, to have you at the program, because you really took us into, collectively, the teacher trainers and myself, into how chiropractic care can help during that postpartum phase of life as well as during pregnancy, and all of the spinal shifts that are happening in the body. And it is a phase, postpartum, a phase where the body's changing. It's greatly changing. So it's good that there are professionals out there such as yourself who are honoring that. Again, there's that word again. I think that's huge. And just acknowledging it and recognizing it. Because as moms, speaking as a mom now, I certainly know after 3 kids, everything that goes on postpartum, I just feel it in my body. But to see it out there and to see someone speaking to it is just great.
Thank you. Yeah, it's just so important for me to, it's definitely my passion to get this information out, as it is your passion as well from the fitness perspective. So we share that passion.
Absolutely.
Yeah. So, Annie, what if a woman, unfortunately, has already developed this DRA? She suspects it, but it hasn't been, officially diagnosed. How can she get more information to know if she indeed has one, and then what can she do to heal herself?
Well, sure. One of the first things that she can do is she can check herself, and this is just a bit difficult to describe verbally speaking, but I'm going to go ahead and do it. And just also know, the audience, that on my blog, bellabellies.com, that I also put up some videos. so that you can visually see that. It's also in the Bella Bellies book, if that interests people, in some of the DVDs that we have, how to check for this. But that's the first step. And where one begins, is laying down and facing up with the knees bent and the feet flat on the floor. And then taking her fingers and pressing into the back of her body. And then from the back of the body, pressing into the side of her body. And just becoming aware of how the tissue and the musculature responds to her touch. And the reason why we start in the back with that touch as well as the side is that's the area that has been the least stretched from pregnancy in relationship to the front of the body where the rectus is. So we start pressing back there, and we kind of get a sense of how our body presses back against our fingertips. So we push in and down, and as we're pressing in, it's kind of like being tickled in a way, although we can't tickle ourselves, but at some point there will be a bit of what we call biofeedback, and the musculature and the fascia and all of that underneath our fingertips is going to contract, and it's going to tighten, and it does that so that we don't press into our internal viscera or in our internal organs. that wouldn't be good. So our body has this natural reflex or response, and we're trying to determine how that is, that reflex or response, how it was prior to pregnancy. So you're palpating the back and then the side. And then once you get to the front of the body, then you start up close to the rib cage and you palpate all the way down, pressing the fingers down at a 45-degree angle. So you don't want to press them directly down because some of the tissue underneath our fingertips is kind of like cellophane or kind of like elastic wrap. And if we push directly down, we don't want to poke through that tissue and create a separation or aggravate a separation that's already there. So very important when you start palpating or touching in the front of your body that you're pressing your fingertips down at a 45-degree angle. And you'll see that on the blog. You'll see that the individual demonstrating is pushing down at a 45-degree angle with all four of her fingertips. And then you palpate high underneath the rib cage and you palpate low. And you move your fingers, if you're using both hands or just one hand, you'll move them across. But eventually you'll palpate in and towards the midline of the body. And some pregnant women will be familiar with something called the linea nigra. That's a dark line that develops during pregnancy. Prior to pregnancy, it's called the linea alba. But during pregnancy, for some women, a strong majority, we get this dark line. And that dark line is where the midline of our body is. And that dark line happens in response to the tissue kind of absorbing some of the hormone called relaxin that's being released out from the placenta. But as you get closer towards the midline of the body where that linea nigra is or where that linea nigra was, then you'll probably start to be aware of less pressure against your fingertips. And you'll get closer towards the umbilicus, and for most individuals, that's where the greatest separation or DRA is. And that's because when we're born, we have our umbilical cord there, and there's a natural separation that should be only 1 or 2 fingers. But for some people, the separation is noticeable right above the belly button or right below the belly button. But for most, it's right on the belly button. And then from there, you'll gently apply strong but comfortable pressure. And then you'll round your chin forward and you'll lift your head up towards the ceiling. And you're just basically hovering your head off the floor. And one will see this in the video. The woman is just hovering her head off the floor ever so slightly. And then you'll be able to determine how many fingers you can put in between your rectus, thus measuring the width apart, and then you'll come down. Now, for a woman who can, with her hand facing towards her, so the back of her hand is facing towards her, so her nail bed or her nails are facing away from her. If that individual with a hand there can fit 5 to 6 of her fingers into her rectus, and she doesn't feel any biofeedback, so she feels no tension underneath those fingertips, nothing preventing her from pressing down further, then she should see a surgeon and get a referral to that surgeon, or possibly to a physical therapist who specializes in women's health, to determine if she's a candidate to have this physical therapy intervention or have it surgical intervention where it's actually stitched back together. Typically the surgeons who do that are surgeons who specialize in hernia. And that's the concern, is that if it's not so much about width, if it's so deep down in and through the viscera, then what's preventing that viscera from coming forward and out and from us developing a hernia, which is a pretty serious condition. So that's very important to note. Of course, with that said, if a woman has any pain or she has this unusual distension through her abdominal wall, then she should absolutely talk to her healthcare provider. If it's under 5 or 6 fingers, now we're looking more at 4 fingers, 3 fingers in width, and there is some feedback to her fingertips. So when she presses down, she feels this resistance against her fingertips. Then she needs to start modifying exercise. And there's the Bella Bellies routine that we do that focuses a lot on exercise modification to help, resolve core dysfunction and to get the core stronger. And we modify all sorts of exercises, but she'll need to do that. And it will take her 9 to 10 months, if not a year, for that to fully heal with exercise modification. If it doesn't heal in that time with exercise modification, as well as, I would say, daily biomechanic modification, so getting up and down correctly, so that you're not crunching your spine up, but rather you're rolling to your side to get up, from good posture so that you're not pressing your abdominal wall forward when you're standing, especially if you're holding a baby. You're not pushing your abdominal wall out to help support the baby. I see that a lot with moms. If there's no change within that time span, 9 months, 10 months, 11 months, 12 months, with consistent exercise modification, then I again would recommend her going to a surgeon who specializes in this type of condition. And the reason why we want to get it and we want to prevent it, prevention is huge, and we want to address it as soon as possible, is that it's not just an aesthetic thing. So a woman who has a diastasis, rectus, abdominis, or DRA, she'll think, gosh, I'm not pregnant, but maybe I look a little pregnant. Or women have come in and they come to Bella Bellies and they say, what's going on with this jelly belly? And I'm just quoting them verbatim. Or one woman called it her mashed potatoes. They'll have this presence of weight to their internal viscera, as well as weight or appearance of their core. And that's one thing. But aside from that, there is also stress on the spine. And I'm sure you've seen that a lot as a chiropractor with diastasis, rectus, abdominis, DRA. Oftentimes they have, a cross from where there's the greatest separation over to the spine. They might have some conditions there in the spine that, you would be able to address and see. So it is additional stress to the spine. It's also dysfunction of the core as a whole. So there's a strong correlation to women who have this DRA and pelvic floor dysfunction. And DRA heightens incontinence, prolapse, all of that. increases the odds about 50%. That's huge. And we live in a country where 1 out of 3 women will have pelvic floor dysfunction. And it's a shame that we don't talk about it too that much, is there's a lot we can do to help prevent it, and DRA, addressing that, is one aspect of helping to prevent this. And, I could go on about that, but that's that for now.
Yeah, I mean, Annie, this information, like I said, is so important because, not only for quality of life for the mother, that first year after giving birth and how she's feeling, like you mentioned, if she does have the DRA that isn't, addressed, then she's going to probably have some back pain because her spine is not able to hold its alignment because the core is so weak. And if she's doing exercises like crunches to strengthen her core, she's actually making the DRA worse. And then what I've seen, I think you've seen it as well, women that are older now, 20, 30 years postpartum,
sure,
are having lots of pelvic floor issues where they're having prolapse of their bladder or their uterus or even their rectum, and it's all connected to not properly rehabbing their abdominal wall and their core after giving birth. So this is really not only quality of life now, but this is for quality of life in the future as well.
That's right. That's huge. And I feel like there's a trend right now because the fitness industry is more embracing DRA, whereas in 2005, 2006, when I was pregnant with my daughter and I was talking about this, it would anger people because it would challenge their way of thinking. Well, gosh, what if I just put a pillow under this pregnant woman's back and then she does a crunch? That should strengthen her abdominal wall. Well, no, there's this condition, intra-abdominal pressure. People would become fiercely angered by that. But now it's starting to be addressed, and some people are starting to capitalize on it. And I just want to caution the audience out there that there are a lot of programs that go towards just healing a DRA. And do know that it's a complicated issue and that a lot of it has to do with your daily biomechanics. So becoming aware of that and how you use your core throughout the day, how your posture is. So if you have good spinal health, that's going to contribute to it. And then also some of the muscles that are away from the core could be dysfunctional and locked and not allowing the pelvis and the rib cage to move, and where the origin and insertion of the rectus is. And so that can kind of create dysfunction. It takes 9 to 10 months to heal. But with these programs, above and beyond that, I want the audience to be aware of that. And then also that in all women's programs, whether they're geared towards DRA, they should also address, or not, they should also address pelvic floor issues, so it should stretch and tone the pelvic floor. That's something we don't see about a lot. And it should also address osteoporosis/osteopenia. That's key and vital, and I make sure that the Bella Bellies program does do that because there's many conditions and many opportunities to address those conditions that are beyond that scope. So I just throw that in there just a little bit, just to help the audience out as much as I can.
Yeah, it's important for people to know, where they can get trusted resources. And, I'm sure on your blog you have also information about like some of that daily biomechanic type information as well as in your book series.
Mhm.
Yeah.
That's right.
Wow, this is so great. So, one question I wanted to end with is, what are your thoughts on belly binding postnatal, like this first month?
Sure. I think it depends on the woman. Now, if the woman has a history of prolapse, and prolapse, as you described before, is measured in grades, but it can be a cystocele, which is the prolapse of the bladder. a uterine prolapse, or a rectus seal, which is the prolapse of the rectum into the vagina or outward. There can also be enteroceal, which is a mixed condition of prolapse. So whatever it is, if she has a history of that, then absolutely she should not be doing any binding, because that's going to aggravate it. If she does choose to go the binding route, she has some flaring of the rib cage, where the rib cage just kind of pops open and it feels like the ribs are pulling apart because maybe baby was up really high during pregnancy and that thrusted the rib cage apart. So she feels she needs some extra assistance in binding to help fuse and heal that rib cage back together. That might be good for her. But again, if there's any history of prolapse at all, even if it's subsided and healed, then you don't want to do the binding. And it depends on the woman. But if she is also binding her rib cage together and maybe going past her rib cage around her abdominal wall and down to her hips, if she's doing that and she's not underneath the guidance of the healthcare provider who might be recommending her to do that certain hours during the day, following this type of protocol, do what they say. That's very important. But if she's doing it independent of that, she probably doesn't want to do that for more than 4 hours, because what happens is there's other muscles in there and they begin not to have to work so hard because the binding is kind of working for them. And you start to see what we call muscle atrophy. So the muscles start to break down. Women come in to me. They say, gosh, I've been binding my core, and I look good. I look real good when I take it off. But then a few hours later, it's all back, and I actually think I look worse now than I did before I started the binding. Well, that could be because of muscle atrophy, that the muscles aren't just working. So if you do that, it should feel good. Especially if you have inflammation of the belly, it'll help kind of compress that inflammation. And a lot of us do have inflammation because the shifting of the small intestine, the shifting of the heart even that we experience postpartum, the shifting of the body as a whole sometimes creates some swelling in there. But make sure you're not doing it more than 4 hours. I will say it's also cultural too. I know after I had my baby, my first, and my grandmother was still alive, she would talk about binding, and she said, are you binding your are you binding your rib cage? Are you binding your wall? You'll need that. That helps you heal. And she would use cheesecloth, and she would bind from underneath my breast, underneath my shoulder blades, all past my belly down to my hips. And I would use that for maybe when I was holding the baby and having my baby in a sling or in a carrier, or doing laundry, something that required, some lifting and so on and so forth. So I hope that helps answer your question.
Yeah, it does. I think that's helpful and good for women to know that this is an option. And, there's even like pre-made belly binders that are out there that can just help, heal the abdominal wall, after giving birth. And like to your point, if you're doing baby wearing, just to give you a little extra support, not to replace the muscles, because we do want to strengthen and get them working as well. But if you're going to be out and about walking for a while wearing your baby, having that extra support can help prevent, issues and pain and such. Yeah.
Absolutely.
So, in closing, I want to, thank you again for coming on. And, it sounds like if there's a woman out there listening who either is wanting to prevent having a DRA or has, determined that she does have one and does not live in the Erie, Pennsylvania area, she can just shoot you an email at info@bellabellies.com, and you can send her referral to somebody who's been trained by you on how to, actually rehab the abdominal wall.
Sure.
Yeah.
Sure, there's that option. That's totally a possibility. And if there's not a trainer in her area, we also have the Bella Bellies books. We have the DVD, which is streamable. And we also have Skyping. So I can always align the participant with someone over Skype, and that's really wonderful because then you don't have to leave your home.
Right.
And we are able to incorporate baby or children into the session. So we always welcome the presence of a little one because that's what postpartum is.
Yeah.
It's a mother relationship with her little one, so we welcome them full arms.
Well, that's great to know that, women anywhere in the country can Skype with you and get your expertise, privately in their own home to help their bodies, heal and recover after giving birth.
That's right, absolutely.
All right. Well, Annie, thanks again for coming on the show. I really appreciate it.
Thank you for having me.